watching us here on Halton News, right here on your TV. It's Tuesday, September 15th, and I'm Jessica Kading. 4 more people have tested positive for COVID-19 since yesterday, with 4 others having fully recovered. Our current total number of active cases in the region remains at 60. 12 of those cases are in Burlington, 28 in Oakville, 17 in Milton, and there are currently 3 people in Halton Hills with the virus. The death toll remains at 25. Protesters gathered outside of Oakville Town Hall today, voicing their concerns about mandated mask wearing. There were 2 distinct groups in attendance. Stephen Rodriguez was there as part of the group appealing to the Halton Catholic District School Board, asking them to reverse their decision on mandatory mask wearing for junior kindergarten through grade 3 students in schools. Tonight, Rodriguez will speak as a delegate at the Halton Catholic District School Board meeting and will once again ask the board to reverse their decision and bring it back in line with the provincial guidelines that have optional mask wearing for those in grades 3 and younger.
It's important to us because we feel that children at that age are not ready to wear masks for the prolonged and extended periods that they are right now. We brought up several points indicating that these children are in the lowest possible risk group for transmission and infection of the virus, and also that it could affect them psychologically down the line, as this is some kind of experiment that's never been done before. And it's kind of scary that this mandate's in place with no end date, and never in the history of the world has anyone been forced to accept this. So we're worried that psychological damage could occur to the children as a result.
When I asked about parents who would prefer their younger children do wear masks, it was made clear that they're not against your children wearing masks, they just want the same option for their own children.
Why we are here, parents who have been dealing with 2 boards, public and Catholic board in Halton, what we would like to emphasize today is that it is important to make this issue less contentious, and let's not make it a public debate. Let's not make it a public poll. I think we should pay respect to the work done by the provincial ministries of education and health, and we follow the guidelines which have been put in place, and we are aware that local boards are given possibility to exceed or change the requirements, but it has to be expert-driven opinion. And this is what we would like to emphasize very strongly. And another thing is that tonight is the vote by the Catholic board, and parents will support our delegates. We have petition that has thousands of signatures, and we would like the trustees to pay attention to that.
The other group in attendance was Hugs Over Masks. I spoke with one of the founders for more on their position.
Is a non-partisan grassroots movement that started during the end of lockdown protest in May at the Queen's Park, and we have 2 main platforms that we focus. One is the Truth Education platform, which is all about providing people with right information, with verified facts, and it's actually designed to combat the fear propaganda that unfortunately has been created by the government and the media, and we're all about education and empowering people with right information. And once people have the right information, they're free to choose whatever they want. However, we definitely draw the line in terms of the government telling us how to manage our bodies and actually mandating medical procedures. And a mask is actually a medical procedure. I'm not even talking about vaccines. Let's just start with masks. The other main initiative with our movement that we're working is actually support and build local communities of like-minded people that first of all can support each other, as well as gather more people from the same areas that might feel lost right now. Because a lot of people have exemptions, they're not even familiar that they're able to exercise their own exemptions against the mandatory masks mandates. So we're doing that part. We're educating people and we're bringing people together so they can be around like-minded, happy, healthy individuals, and children can play together. And that's some of the things that we've been working. We currently have over 20 chapters all across Canada. We 7 chapters in the United States and growing, and we're actually international as well. We have Australia, UK. So the movement has started in Queen's Park, but now definitely around the world.
I asked him to elaborate on what he meant when he referred to the information being spread by the government and media.
The government always talks about cases. You know, they're creating this new fear propaganda with cases. And from the very beginning, I mean, back in March and April, I mean, that's how I kind of woke up and created the movement to educate people is cases means nothing. We want to know how many people are serious enough that they has to be hospitalized and how many deaths obviously happening. And those are the numbers that you don't hear at all anymore. The only number you hear all the time is how many new cases. The case just means a positive test, which also been said even on Ontario government alone that the test can be almost 50% false positive. So what exactly are we tracking here? The only thing, again, we should be tracking is how many people are serious enough that they need hospital help. And those numbers are not completely discussed. On September 9th, Dr. Tam made a statement on the public, on the government website saying the infection rate is 1.1%. That's the infection rate. That's mean how many people are supposed to have in this virus. It doesn't make any sense. So what I'm saying now is we never had a first wave. That's why we shouldn't be scared of a second one.
Proposals to expand the coverage of the Halton Regional Mask Bylaw are on Halton Council's agenda for tomorrow morning. The expansions would include enclosed common areas of condominium and apartment buildings, including lobbies, elevators, laundry rooms, and mail rooms. Oakville's Mayor Rob Burton issued a statement in response to the protest today and says that Halton's mask bylaw was created by following the advice and support of Dr. Hamida Magani, Halton's Medical Officer of Health. Council debated the measure extensively. He would also like to encourage residents and visitors to adhere to the bylaws and antivirus safety practices for everyone's safety. Meanwhile, Joseph Brant Hospital is preparing for a possible surge of COVID-19 patients and has been designated as a hospital to provide acute COVID-19 care. In this next video, you'll get an inside look at Joe Brant's pandemic response unit.
Pandemic Response Unit is part of our plan to surge up in terms of seeing increased number of patients that we will expect to see over the weeks ahead, and also provide us a mechanism to also then transition patients who are COVID positive, medium to mild, from the hospital to this unit and then back home into the community with supports.
In planning to take care of the expected surge of COVID positive patients, there were special considerations that we had to make when we were designing the Pandemic Response Unit. The facility itself is designed with painstaking attention to infection prevention control best practices. Every surface is easy to clean, and they are all designed with the patient in mind. We wanted to design a structure that would minimize the spread of infectious particles and protect our staff and patients as best as possible. All air coming in and out of the unit is HEPA filtered. The exhaust system allows for the rapid exchange of air in the building multiple times per hour. The floors of the Pandemic Response Unit have been sealed, which makes for easier cleaning and less chance of infectious materials to be transmitted through the feet of care providers, staff, and patients. In addition, the negative pressure environment is maintained by an airlock system that allows patients to be transported to and from the hospital using a tunnel. We can use the tunnel to make sure that air handled through the unit has already been filtered. The Pandemic Response Unit is designed to be used as an all-season structure. It is weatherproof and waterproof, and the air handling systems are designed to heat and cool the structure to allow for patient comfort continuously regardless of the weather outside.
The Pandemic Response Unit is not only an important resource for our community, but for other hospitals in the region if the need arises. As part of our regional strategy, the Pandemic Response Unit will be a resource available to all hospitals in the Hamilton, Niagara, Haldimand, Norfolk, and Brant area to provide COVID-19 patient care. This will help accommodate fluctuations in demand for COVID-19 care while minimizing any possible disruption of scheduled care across the region. Joe Brant Hospital will also serve as one of the 4 designated hospitals providing acute care for COVID inpatients. As we move into the next phase of pandemic planning, we stand at the ready with a state-of-the-art facility that will serve as a regional resource to provide exemplary care to COVID-19 patients.
I'd like to thank Sprung Corporate, the manufacturer of the Pandemic Response Unit, and also BLT Constructors. Without all of your support, we would not have this response and resource available to care for COVID-19 patients in Burlington and area. Thank you so much.
Provincially, Premier Doug Ford has placed Ontario on a 4-week hold in Stage 3. I spoke with Burlington's Mayor Marianne Mead Ward about how residents are coping.
Well, I continue to say that Burlington residents are doing their part to keep themselves and their neighbors safe, and our numbers still show it. We still are per capita the lowest infection rates in the greater golden horseshoe. We've been that way since the very beginning of this pandemic. We still are. When you hear about those big spikes Ontario wide, or even in Halton, it is Burlington has still got 12 active cases. That's it, 12. The spikes in Ontario are happening really in three isolated areas: Ottawa, Toronto, and Peel. And Burlington and Halton region have an infection rate that is less than half what the Ontario average is. So that's a credit to our residents doing what they need to do, wearing masks, keeping 6 feet distance from people that aren't in their social bubble, hand washing, and all of the other steps to keep themselves and others safe. So keep it up. Keep up the good work, Burlington. We are doing really well, but we can't ever become complacent. There is still a deadly virus in our community, and we need to be on guard and continue to follow those measures. And they have been, which is great.
There are a lot of other items being addressed on the mayor's agenda this week as well, including grants for local businesses.
Well, there is an awful lot going on. This is, as we colloquially call it, committee week. So there's a lot of business going on. We had a committee meeting earlier today, and a couple of huge items that were passed. One is the criteria for our small business grant program. Still needs to be approved by council on September 28th, but what it does is provide some eligibility criteria for the $125,000 that the city set aside to assist with purchase of PPE or other measures that small businesses have had to take to protect their staff and their their customers from COVID-19. So that was approved, and it will apply specifically to small businesses, and that is classified as a business with 20 or less employees. And I was shocked to discover that 65% of our businesses fall into that category. So we truly are run in the city by small business entrepreneurs. So that is huge. And tomorrow's regional council meeting, we are asking for matching funding. So that will be an interesting conversation. We're hoping to get 250 total in the kitty. We're going to proceed whether the region steps up or not, but we really hope they do.
Yes, COVID-19 is certainly going to affect municipal budgets across Halton, and the town of Milton is no different. Melissa Candelaria reports.
Milton Council has begun budget talks this week. Town staff presented a report to Council at a workshop meeting Monday proposing a 5% increase on the town's portion of the budget. An increase Councillor John Challoner says is too high.
We have unemployment approaching 11% in our community. We have unprecedented fiscal damage to a number of sectors, including hospitality, transportation, energy. There's a lot of businesses that we don't know what the other side is going to look like for them. They may be gone. There's been reports out about hospitality possibly losing 60% of its base across the country, and we've already seen a number of well-known restaurants in our community close. So the times are extraordinary. Town does have the reserves. It has a history of saving for rainy days. And so there is an opportunity to offset a tax increase with reserves for a year, possibly 2 years. We've also had, very fortunately, support from the province of Ontario to the tune of about $2.8 million. And that grant would probably be spread over a couple of years. But as I indicated last night, and I've had a lot of discussions with the treasurer about this, you want to have a soft landing. You want to be in a position where, when that grant stops, you do have an obligation to replace that money, and you hope that on the other side, town revenues are increasing, so that you're not in effect delaying the fiscal damage. You're actually helping to assuage it. by proper use of that grant and proper use of reserves.
Now, Councillor Challoner will be putting a motion before Council to bring down that potential tax increase to about 2 to 3%. A decrease, he says, is doable.
There's some really positive things that we've been doing in the last 18 months that should see us be in a better place by the time this all ends. And one thing is we've undertaken a two-phase service delivery review where we've analyzed every department in the municipality and asked the question, how could we do this better? How can we provide services better to our residents? Are there services that we're offering that nobody cares about anymore and we shouldn't be offering at all? Are we using technology to its greatest advantage? Our services that we provide today generally are very, very well provided by our staff, but are they provided efficiently and cost effectively? And we're finding that they're not as cost effective or as efficient as they should be. And so we're taking the opportunity to make the improvements necessary and the investments necessary to come out on the other side even better than we are today. So there are, some great positives to come out of this, and I think you'll see through the budget discussion a review of some services and how they're going to be delivered in future, and whether some will continue to be delivered at all, and that will, factor in how we land at 3% or 2% or 1%.
Budget discussions will officially kick off at the September 21st Council meeting and will likely continue well into December. Reporting for Halton News, I'm Melissa Candelaria.
Still ahead, a story by Nikki Wesley that's sure to bring you a smile. We'll be right back. Welcome back to Halton News. This week, supporting the food bank has never been tastier. Nikki Wesley explains.
We have smile cookies going on this week. It's $1 to buy a cookie, and 100% of the proceeds go to Burlington Food Bank. So every single cookie that goes out the door, proceeds get handed directly to the food bank, a local charity, which is awesome.
They make more than 30 times the regular number of cookies during Smile Cookie Week. The staff are all on board helping decorate the chocolate chunk cookies.
For ourselves, we're very proud of our relationship we have with the Burlington Food Bank.
Yeah.
And we vote every year in our region for it, and it's always across the board, everyone votes for it.
Burlington Tim Hortons have been supporting the Burlington Food Bank as their charity of choice for more than 10 years.
When times get tough, you start to scale back on donating to local charities and everything like that, right? So we were really excited when we saw right in the middle of when COVID was almost at its worst in March and April and everything like that, they said, no, we're doing Smile Cookies, we're pushing forward with it, prepare, plan ahead. It just showed how much they were committed to it.
The Manders own 5 stores in Burlington that raised $19,000 for the Burlington Food Bank last year. This year, they're aiming for $20,000. Burlington Food Bank Executive Director Robin Bailey.
This year, it's a huge help. Our fundraising that we can normally do, we're not able to do. And so for the Tim Hortons to be able to come alongside us again and be able to up what we have coming in at a time when we've already seen as many clients this year as we did in the entirety of 2019. So it's just a huge help for us to be able to continue to provide all the necessary foods that we try to, as well as fresh produce and all those types of things. And the biggest thing for us is the snack program that we do for kids. And that's really where a lot of the Smile Cookie money goes to.
Getting a cookie while donating a whole $1 to the food bank helped put a smile on this little customer's face this morning. Reporting for Halton News, I'm Nikki Wesley.
Taking a look at our local weather forecast after this nice view of downtown Oakville. We have our 5-day outlook and look at all that sunshine. Our warmest day of the week will be tomorrow, 25 degrees as our high, and then it will cool down significantly for the rest of our outlook. Only reaching 16 degrees as a high on both Thursday and Friday. Looking into the weekend, Saturday, 18 degrees, the warmer of 2 days, but both days nice for outdoor activities. And now we'll look to how Halton's top companies performed on the markets today. When we come back, more on the 40th anniversary of Terry Fox's Marathon of Hope. Burlington's Jeanette Wilson has taken on the 40th anniversary of Terry Fox Marathon of Hope as an opportunity to follow Terry's inspirational example. Nikki Wesley explains.
Losing my mom to cancer really hit home, really hit hard, and it was that year that we actually started doing the Terry Fox Marathon of Hope. We did it down here with my daughter and my husband and my granddaughter, and it really hit home how many people are actually suffering from cancer, and we really do need to find a cure for cancer.
This will be Team Wilson's 8th year participating in the Burlington Terry Fox. Jeanette is also the Terry Fox ambassador where she works at Adidas. She plans the associated fundraising events for her fellow employees.
This year, with it being virtual, we had to come up with different ways to raise money and just try to continue to raise money.
Realizing that this year may not be as profitable, she took the problem on as a personal challenge.
I just thought, what if I raise $40,000? Maybe I'll shave my head. And it kind of started out as a joke. And then we decided that I decided that I was going to do it.
She aims to raise the money by September 20th. She's not only set up a sponsor page, she has also reached out to 2 restaurants, Barafion and Gator Ted's, as well as Denninger stores, to help with her fundraising.
The Adidas, the Orion cutout shoe, to post in their restaurants for people to buy them and post on their walls.
While her fundraising page, terryfox.ca/Jeanette Wilson, will be open to the end of the year, she's aiming to raise $20,000 before the additional fundraising and head shaving event at Barafion's restaurant this weekend. Her husband, Sean Wilson, has watched Jeanette's commitment to the cause grow over the last 8 years.
Started off small and she's slowly gotten bigger and bigger, and we've done it together all along, so it's a proud feeling. Coming down here and actually seeing Terry when he ran through here in 1980, it makes me feel proud to know that she's come on board and done what she's done, and it's just going to grow from there.
Reporting for Halton News, I'm Nikki Wesley.
Thanks for watching us here. We'll be back live tomorrow night at 5:30.